Have you ever felt completely lost trying to navigate a really complex system? Especially, when you or someone close needs help urgently.
Oh, absolutely. Healthcare is a prime example, isn't it? It can feel like this fragmented maze.
Exactly. And it's incredibly tough to get the right support at
Yeah.
the right time. This is, well, it's a huge struggle for older people with cancer and their families.
Hmm.
They often feel cut off from the services they desperately need.
It's a critical issue.
That's precisely why in this deep dive, we're trying to cut through the noise and unpack a really interesting initiative, the EU Navigate project.
Right, the Horizon Europe funded one.
Yes, it's taking a successful patient navigation model from Canada and adapting it for Europe, aiming to address these unmet needs.
Mm-hmm.
So our mission today is really to understand how this more, human-centered approach works and how it helps people find their way.
Okay.
Now, let's just grasp the scale of this challenge first, because the numbers are, frankly, quite sobering.
They really are. Living longer is great, obviously. Huge achievement for society.
But cancer disproportionately hits older people.
That's the reality. If you look at the 2020 estimates for the EU, something like 60% of all new cancer diagnoses.
60%? Wow.
Yes, and even more starkly, 73% of cancer-related deaths were in people over 65.
That's staggering. And you mentioned unique hurdles for this group. What makes it so particularly difficult?
Well, there are several factors. Often, older patients get diagnosed later at more advanced stages.
Why is that?
It can be complex. Maybe symptoms are dismissed as just getting older, or other health issues mask the cancer. And perhaps surprisingly, they sometimes receive less intensive oncological treatment.
Really? Less treatment?
It can happen. Plus, cancer significantly worsens existing geriatric conditions, things like having multiple chronic illnesses or frailty.
Ah, okay, so it layers on top of existing problems.
Precisely. And if you zoom out, this connects to broader issues. Older adults might face a higher risk of poverty or social isolation, and think about the immense burden on family caregivers.
Right, who are often trying to juggle everything, coordinating fragmented services.
Exactly. It becomes a systemic problem, not just an individual one.
Okay, so we're talking about providing a guide, connecting the dots. What does that actually look like? What is a navigation intervention?
So fundamentally, it's a program, a dedicated program set up to support, educate, and crucially, empower people.
How does it do that?
By actively identifying the barriers individuals face, whether they're practical, informational, emotional, and then helping to dismantle those barriers. The aim is timely access to the right services.
And the navigator, that's not just another doctor or nurse.
No, that's key. The navigator is a distinct person. They could be a trained volunteer or sometimes a professional like a social worker. Their role is specifically to guide, to connect people to resources, and to advocate for them.
Advocate, that sounds important.
It really is. A core idea is patient empowerment and health promotion, putting the person, more in control of their own care journey.
Interesting. And these programs started mainly in North America.
Yes, largely the US and Canada, and the results there have been quite promising, showing they're feasible and seem effective, especially in the earlier phases of cancer care.
But maybe less evidence for later stages.
Right. The evidence base is still developing for palliative and end-of-life care contexts.
So how is EU Navigate taking this North American model and making it work in Europe?
They're specifically adapting the Canadian NavCare program. NavCare stands for navigation, connecting, advocating, resourcing, and engaging.
Okay, NavCare.
Yeah, and it's very much built around a person and family-centered approach. It uses these specially trained volunteers, although in Poland they're using social workers, adapting locally.
Ah, good point, adapting to the local system.
Exactly. To improve quality of life, foster that empowerment we talked about, and help older people with declining health from cancer access the health and social services they need.
And which countries are involved in this pilot?
It's being tested and evaluated across 6 EU countries right now. Belgium, Ireland, Italy, the Netherlands, Poland, and Portugal. Quite a diverse mix.
That is diverse. And
Yeah.
you mentioned evaluation. How are they measuring success? It sounds like quite a rigorous setup.
It really is. It's not just a small pilot. It's an international, pragmatic, randomized controlled trial, an RCT.
An RCT. Okay, that's the gold standard for evidence, isn't it?
Pretty much. And what's really interesting is the design. They call it a fast-track design.
Fast track. What does that mean?
It means the control group, the group that doesn't initially get the navigator, isn't just left out. After 24 weeks, they also receive the navigation interventions.
Oh, I see. So everyone eventually benefits, but they can still compare the groups scientifically.
Precisely. It's rigorous, but also ethical. They're measuring key things like global health status, quality of life for the person with cancer, their social support levels,
Makes sense.
but also the impact on the family caregivers, their burden, and the overall cost effectiveness for the healthcare system.
Cost effectiveness is crucial for sustainability.
Absolutely. And the group running this, the consortium, is broad. It even includes the original Canadian developers of NavCare. It really highlights the collaborative nature of the project.
So thinking about the big picture then, what are the hoped for outcomes? What could this really change?
Well, for older people with cancer, the hope is clearly better quality of life, getting the help they need when they need it, and feeling more empowered within what can be a really daunting system.
And for the health systems?
For the systems, the potential is there for reducing the overall societal and economic burden of cancer care in this population, potentially leading to more sustainable models long term.
It sounds incredibly promising, but are there specific challenges, maybe cultural or system differences between, say, Canada and Italy or Poland that make this adaptation tricky?
That's a really important question, and that's actually why the pragmatic nature of the trial is key.
Pragmatic meaning real world.
Exactly. It's designed to test how well it works in these diverse real-world settings with all their complexities. The ultimate goal is to develop solid, evidence-based recommendations.
Recommendations for policy, for practice.
For both. The idea is to create a model that's genuinely scalable and transferable, something that could be adapted across different European healthcare systems.
So contributing to a more equitable system overall.
Yes, contributing to more equitable healthcare and hopefully a more inclusive society for older adults facing these challenges.
This deep dive really highlights the sort of quiet power of patient navigation. It seems like such a common sense idea, but potentially profound in its impact for complex care.
It really does, and it brings up a wider point, doesn't it?
What's that?
Well, it raises an important question for all of us, I think. How might these adaptable, community-focused navigation models like EU Navigate reshape support not just for cancer, but for other vulnerable populations too? Could this be a way to foster better well-being and health equity right across society?